The Kenya National Union of Nurses says only 3 out of the 47 counties have implemented the return to work formula. It is against this backdrop that the union has issued a strike notice starting Monday next week if the remaining 44 counties do not abide by the 2017 agreement. The 3 counties that have complied are Machakos, Migori and Mombasa. Kenya National Union of Nurses Secretary General Seth Panyako says the much-hyped universal health cover will be a mirage if nurses' demands are not met. Of all the 4 counties of Nyeri, Kisumu, Isiolo and Machakos where UHC is being piloted, only Machakos has implemented the 2017 nurses return to work formula. I'd like us now to listen into what Seth Panyako had to say earlier on this morning. Remember, he's the Kenya National Union of Nurses Secretary General.
Beginning 4th February 2019, which is on Monday. The strike notices has been issued to individual employers within the government. And therefore, those specific employers, the nurses in those county governments, will begin the strike beginning 4th. There are those who will begin on 4th, there are those who will begin on 5th, there are those who will begin on 11th. But what we know from 4th January, which is 4th February, which is next week on Monday, nurses will begin the strike in the...
So remember, the last strike took about 5 months, and we all saw the frustration, the suffering of patients in public hospitals. So if this does indeed happen, then we may get back to square one as a country. And remember, this is on the backdrop of UHC, one of the key pillars of President Uhuru Kenyatta, part of the legacy he intends to leave behind. So I'll be having a conversation about this with Seth Panyako. He's the Kenya National Union of Nurses Secretary General. We'll also be speaking to Matthew Wile, who is the Deputy Governor, Kisumu County. Remember, Kisumu County is one of the pioneer counties with respect to UHC. That was launched by President Uhuru Kenyatta not long ago. But before we speak to them, let me bring in my colleague Sophia Wanuna, who's the lead reporter for The Big Story. Sophia, I listened into the nurses during the day, and they were citing part of the frustration that they've had, and key among the frustration that they're talking about is to do with SRC. They're saying SRC has been taking them back and forth.
Indeed, good evening, Linda. Yes, so the 44 counties have been warned by the Nurses Union, the Kenya National Nurses Union. They're saying only 3 counties have been able to pay the nurses in their counties. The other 4, there's those dates starting Monday that they're promising to down their tools. But also, before I get into the issue of SRC, another strike notice issued on the 28th of January this year by the Kenya Union of Clinical Officers. They've given the government, that's the Ministry of Health, and the other stakeholders involved, COG and others, 14 days to continue with talks on their CBA, failure to which they also will down their tools. So this is looking like it's going to be another situation, again, of some sense of paralysis when it comes to healthcare delivery. But back to the issues at hand, and as far as the Nurses Union is concerned, I have seen a letter that was written in December last year from the SRC to the Council of Governors. And in this letter, the SRC is saying that they have noted that the Council of Governors wrote to all the counties, the 47 governors, saying that they needed to be able to seek the SRC's advice before they then went ahead to make payment in as far as the nursing service allowances and the uniform allowances. Those are the 2 areas of dispute, those 2 allowances. So the Council of Governors advises the counties to be able to consult and check with the SRC before then making any form of payment. And so the SRC in this letter gives 3 guidelines which each county should consider before making any payment in as far as those allowances is concerned. One is affordability. The SRC says just because a county has a certain allocation doesn't in itself equate to money at hand. Allocations will be there, but we know issues about delay in disbursement. Sometimes not the full amount is disbursed to a county. So before they make any payment, a county should check and consult. Does it have the money at hand as opposed to what has been allocated to the county? The second issue SRC advises the county governments to put into consideration is fiscal sustainability. And in essence, this is, does it have the money not only to pay in one instance, but to continue to do so in coming months? So that is something they're meant to check with what they have as their budgets, their other constraints as well, but the money that's coming in. Remember, they all don't get the same amount of money. So those are the considerations they're also told to put in place. And finally is equity as well. That is this, if they pay these allowances, is it equitable in as far as other comparable jobs is the kind of language that is used by the SRC in this letter. And therein lies the issue, Linda, because on one hand, when these meetings happen and engagement, consultation, consensus is reached in as far as a CBA, it's in a group, the counties, then there's SRC, there's a national government. But when it comes to delivery, then they start being treated differently. And that isolation is perhaps one of the biggest problems and impediments in as far as being able to reach a solution in this particular case. And in fact, the clinical workers as well raise it as an issue. They said that it is not feasible for then the authorities, the SRC or the COG, to say be dealt with separately in terms of counties, because they sat on the table as an union, as an entity, and they're meant to be handled as such and not then to be sidelined to take one-on-one, because then that takes everybody back to the negotiating table. But Linda, perhaps some more perspective on how really we got here, because the issues around the healthcare have been ongoing since the advent of devolution, when that system of governance came into place. And the thing is, the healthcare was devolved. So it's a devolved function. But at the very onset, you remember, the hue and cry from the health service providers was at least leave the element of human resource to the national government. Why were they arguing this? Because there were no structures at the county level in as far as how disbursements are made. And anyway, remember, cash, money that pays them, anyway, at the end of the day, comes from Treasury at the national government. It comes then to the county governments, then to be disbursed to the various counties and then to the health workers. So the argument at the time was there are already existing structures that go down to the local levels at the national government, so leave it there. But of course that hasn't stood. And so what we've witnessed, even with the various strike notices, the strikes that have unfolded, the deliberations and discussions, even with the doctors, has been being thrown back and forth. The almost ping pong going on in our health services. And the ball in this ping pong is the health care service workers, in the sense that when they go to the county governments to ask for what is their due, the county government says we're still waiting for money from Treasury, which is a national government. So they engage with them, the Treasury throws them back to SRC. You have to seek advice from them. Then SRC says, you know, we have to engage with what is available, those three criteria I talked to you about, affordability, sustainability, which are beyond the healthcare providers and the services. And as far as you have the clinical officers, you have the nurses, you've seen the doctors in the past. So it appears to be a lot of confusion, and perhaps streamlining is of urgent importance. And we'll hear, because you have the SG with you, who will be able to speak more comprehensively to this. But also one of the issues compounding, before I hand it back to you, Linda, is that as much as on one hand we're saying it's a devolved function, and you've seen now the issues already that they're grappling with the back and forth with the various officers and officials, is that then the national government has taken up universal healthcare provision as a big four agenda. So there are those who argue that this is pulling back, clawing back on the gains of devolution, that the national government still wants to hold on in the name of big four on healthcare, and then that interferes with how they're able to support county governments to be fully seized of this service provision. But then each side will make arguments that will, some have argued, worked for them and in their favor at any given time. But at the end of the day, important to note is that when they're not agreeing, when there's this kind of disputes, when there are strike notices, it's ordinary Mwananchi that's left to suffer. Linda.
Fear, when that 5-month strike was there, we covered this for a while. And of course, you have reporters across the country, and you'd see people lining up with nowhere to go, and the ones who are saying we cannot afford to go to private hospitals. So basically, we're back to square one. If this actually happens, if the strike actually does take place, then these are the scenarios that we're going to see. Can Sophia hear me?
Yes, I can hear you, Linda.
Yeah, so I'm saying, Sophia, when we had the 5-month strike nurses, we covered this as well with you. And I remember we had long lines of people just saying they are not able to go to private hospitals. And we had a couple of people losing their lives as well. And we are basically heading back to that particular point, if at all this agreement is not adhered to.
Exactly, Linda, and healthcare, acquisition of the same for ordinary Mwananchi in private hospitals especially is very expensive. And we've seen that in the past. We've covered even some of the ordeals families have grappled with, whether it's when a loved one dies and what they're left to deal with, but even just getting that service. So many of them then rely on what Kenya is saying it's seeking to achieve, universal healthcare. But clearly there's a breakdown in as far as harmonization. How does a devolved function then get rationalized to the sense that ordinary Mwananchi is able to benefit without this back and forth? Because when there's all of this infighting and finger pointing and passing the buck, that then becomes the thorn in terms of figuring all this out, that there's no backstop. When the health workers go to the counties, as I said, they'll take them back to this other institution and then to the other and then to the other. When they sit to agree, which is what happens with these CBAs, now again this consultation based on individual county governments and the officers. And this, remember, some of these negotiations go on for a year. Clinical workers in their letter, which I've also had a look at, started all the way from 2017, 1 year, and then in the middle of last year, around April, the government just stopped engaging, and that's why they're issuing this threat. But I will tell you also, there is a concern growing in the Council of Governors that there's too many unions coming up, okay? You have the union, nurses union, then you have the clinical workers, there's the doctors, and all of these others, and they're saying almost now unions left, right, and center, each with their sets of demands, threats of downing their tools, and wondering, is this then becoming some form and quote-unquote circus? It's how some of them have described it. But it's critical because there are these offices in the Council of Governors, and there is this functions and clarity of this. I mean, as far as the county is concerned, they all need to sit down. They all need to set house in order, and especially also with the national government, because very critical to note, it is ordinary Mwananchi that will suffer. They're the ones who will end up with no drugs. They're the ones who will end up with no people to attend to them.
I know, Sophia, I know, and it's a conversation that we absolutely must have. Like you say, it's almost like clawing back. Remember a couple of weeks ago, there was talk to regulate doctors' fee, and then that just gets settled. You have nurses now threatening to go on strike. And then, as Sophia mentioned, you have clinical workers also saying they're going to go on strike. And then you have universal health care, that is a pet project of President Uhuru Kenyatta that is also now being threatened. So it's just a circus or a circle of some sort, if I may use that particular description. But let's now have this conversation with Seth Panyako, who's the Kenya National Union of Nurses Secretary General. Sir, thank you so much for joining us on The Big Story this evening. We'll also be speaking to Matthew Willie, who's the Deputy Governor, Kisumu County. Thank you so much for joining us as well on The Big Story. Mr. Panyako, let me begin with you. So just listening into Sophia explaining the back and forth between the Nurses Union and SRC and the concerns raised by governors, how did we get here?
We have gotten there because it's very unfortunate in this country that when the poor Kenyans go into an election system, they have every belief and legitimate expectations that they are electing a government which is going to put into interest and protect the rights of the most vulnerable citizens in this country. And those are the most poor Kenyans who access healthcare services within the public health facilities. And when we have agreement as a union with the government, two levels of government, this agreement was entered at the highest level of government. We had the cabinet secretary, we have the chair of the Council of Governors, we had the chair of the HR, we had the chair of health, and we had everyone in government on the table. And there was high level of consultation, even Office of the President was consulted. And we entered this agreement in 2017. Remember the collective bargaining agreement, we began that negotiation where from 2013 up to now. What we have is insincerity within government, and we have people who have been put in place, especially the Council of Governors and the SRC, who are using their positions to fight political wars. In fact, some of the governors who are willing to pay this money, one of them told me, I'm not going to allow SCOG and SRC to plunge my county into unnecessary strike because of their own personal interests. For example, there was an agreement was done on 2nd November 2017, and there was a letter that was released. When we agreed was that county governments and the national government were going to factor this money in 2018-2017 financial year, and that is why it was not implemented on time. And we agreed with the government, looking at, we had come from an election that was very destructive, people had fought, people had died, so we felt like it was important that we give the government time to find money and factor in the budget. And to make it very clear, the national government, the treasurer, allocated money to the county governments to ensure that when it does budgeting, it has enough money to budget for this particular increment. And that is why the allocation for the county government was increased. So we have almost all county governments, maybe about one government, two governments, maybe that is Siaya and Kitui, which are showing signs of not having interest to pay, who are saying they don't have money. But other 45 county governments have the money. The problem they have has been, when they want to pay, they were told SRC was not in place. When SRC came in place, SRC says now, can you give us letters showing that you have the money to pay? Then the governors write the letters and say, we have money, we have factored in the budget, we want to pay. Now SRC comes up with another letter and said other set of requirements that are not here nor there, because once you have agreed, an employer has agreed with a trade union, it's important that that mutual agreement be respected for the interest of the workers and the interest of the common people that we serve. Now, as we continue to engage SRC, we have a letter written by Jacqueline Mokeni, the CEO for Council of Governors, which is dated 18th December 2018, directing SRC not to allow that money to be paid because county governments don't have money. And as we are talking, 45 county governments have written letters to my office saying they have money, they want to pay. As even I'm talking today, we have had a meeting with the Rakanidhi, and the Rakanidhi has said they are going to pay this money in the payslip of February. And we have COG, CEO, who's writing letters to the SRC saying, don't allow the Rakanidhi to pay. So what kind of government do we have?
Hold on. So this would be a perfect time to bring in Kisumu Deputy Governor Matthew Owele. Listening in to Seth Panyako, and first of all, before you even get there, I want to look at some of the agreement that the Nurses Union had, some of the demands they had made. I'm hoping that can be on your screen any minute from now. There we go. So that is the 2017 Nurses Return to Work formula. That is what the nurses are asking for. So they wanted a uniform allowance that would keep increasing from 15,000, 20,000, to 25, and then you had the nursing service allowance as well. So those are the numbers that they're working with, and those are the numbers that the nurses have not been able to get up until now. And that is a conversation that Seth Panyako now says is raising a lot of concern, with nurses now giving that strike notice. So let's speak to the Deputy Governor in the county of Kisumu, Matthew Owele. Sir, so I'm listening into Seth Panyako, and he says there's a back and forth between SRC and county governments, and at some point county governments are saying they do not have money. And this is a concern specifically for your county as well, because your county is one of the pioneer counties of universal health care. What is going on?
Thank you. I want to start by putting things into perspective.
Please.
First of all, as a county, we are grateful that we are one of the 4 that are piloting universal health coverage. And having said that, you rightly observe that we have had communication obtaining from the CBA that was a negotiated agreement between the Nursing Council, the Council of Governors, the State Department of Health, and of course the State Department of Labor. In a communication from the COG dated November 2018, we were directed as county governments to be able to implement the agreements of the CBA. And so we know that for the uniform allowance, we were meant to factor in 5,000, an increment of 5,000 per nurse in the financial years of 2018-2019, 2019-2020, and 2020-2021. And for the nursing service allowance, we are meant to factor in 3,000 for the 2018-2019, 3,500 for 2019-2020, and the same amount, 3,500 for 2020-2021. Now, you may know that most counties, some of them have not even passed the budget. For a case of Kisumu County, our budget was just passed less than 3 weeks ago. And so, for us, we have a meeting this Friday to try and resolve this issue internally, within the county. But may I also inform the Nursing Council, I don't speak on behalf of the COG, but I know that tomorrow there is a meeting between the Council of Governors, the State Department of Health, Labor, and of course the Nursing Council to be able to resolve this issue. And allow me to say that, for example, in Kisumu and of course the other counties that are piloting universal health coverage, it would be a disaster, for example, if the nurses were to go on strike. May I say also at this point that other than the 2010 Constitution, the issue of universal health coverage, when fully rolled out, will be one of the greatest things to have happened to the people of Kenya. And so the nursing, the team that is spearheading, the welfare of the nurses, I want to tell them that counties are working around the clock to ensure that health services are not interrupted.
If nurses in your county go on strike, because there's a lot of hope with respect to UHC in the pioneer counties, Kisumu being one of them. So let me just ask you, in terms of the status of universal healthcare in Kisumu, could you paint a picture of what exactly has gone on from the time the president was there until now?
This has taken quite a bit of time to put together. Before the rollout of universal health coverage, when His Excellency President Uhuru Kenyatta came down to Kisumu to officially launch UHC, we did a needs assessment in terms of the human resource requirements that we need. And I can tell you, like for example, Kisumu, we need all our nurses on board because we have about 827 at the moment. Our need is about 4,000. We do not have money to employ more nurses. So you can imagine if the few that we have actually get to go on strike. We also got to see what we need in...
Hold on. You have 800, but you need 4,000, if I got you correctly. 4,000,
you can imagine, wow. Yes.
Okay, go on.
Yeah, so there's a big need for human resources for us to successfully roll out universal health coverage. And so the counties are working together closely with the State Department of Health to see if the gaps that have been identified can be closed. But what I can tell you is that this issue of universal health coverage is basically a game changer. You can't imagine a patient walking into a facility, getting all the services that they need to have, and getting out of the gate of the hospital without paying a single penny. Okay. I would have loved, and we hope that we are able to resolve this issue locally so that this service is not interrupted, at least for the 6 months, so that we can be able to gauge as Kenyans whether we can roll out the issue of universal health coverage countrywide. Yeah,
seems like the onus is on county governments and the SRC as well. Let's see if we can get to a solution at some point because we have the union's Secretary General speaking to me as well. And I'll try to pick his mind just after this short break. You're watching The Big Story. Let me take a break, and when we come back, we'll speak to Seth Panyako on the back and forth that they say SRC has been taking them through.